Welcome to the JEMS Report, brought to you by Clearing Events, Fire and Rescue Group, and the Journal of Emergency Medical Services. My name is Ted Lee. I'm the Editor-in-Chief of JEMS, along with Jeff Frankel, the Managing Editor. The JEMS Report brings to you position experts and key players in emergency medical services, talking about the news and hot topics revolving around pre-hospital medicine. And today we have a very special guest with us, Dr. Jeffrey Goodloe. And we will be talking a little bit about EMS Week and EMS Recognition Day, which is Friday of EMS Week. Dr. Goodloe, thank you for joining us.
My pleasure, Ted. It's so fantastic to be here. Really excited to take part in this.
So giving a little bit of background to our group, why don't you tell us a little bit about your EMS experience and history?
Yeah, so you know what? The short of it is, my name's Jeff, and I like to help people. And EMS was such a perfect fit for that, huh? So actually, I was just thinking about this a little earlier today. A little over a month from now, I will start my 37th year in EMS. And a fantastic journey of really getting to serve in so many different roles. Dispatcher for a little while, and field EMT, EMT intermediate, paramedic. And then I just kept going to school for a while. Had a wonderful experience in medical school. Pretty naturally decided I wanted to do emergency medicine before I ever got there because of the great experiences and challenges, great learning opportunities through EMS. And so really emergency medicine was just sort of that natural choice for me. Because of that, and trained both in San Antonio in medical school, Indianapolis, emergency medicine residency training, came back to Texas, did an EMS fellowship at UT Southwestern Medical Center in Dallas, worked at Parkland Memorial Hospital for a little bit, moved up the road to Plano, Texas for a while, and such a great memory and experience of all the years up there, and then got a call that just really accelerated things in terms of the volume of patients I can help through EMS. Been so honored and humbled and privileged to serve as now the Chief Medical Officer for the EMS system for metropolitan Oklahoma City and Tulsa. Last year, we did a little over 267,000 calls between those two major metropolitan areas here in the state of Oklahoma. Just a great opportunity to help a lot of people that really need us. And it's just such an incredible joy and blessing to work with over 2,700 uniformed personnel between our shared ambulance service, the Emergency Medical Services Authority, Oklahoma City Fire Department, Tulsa Fire Department, a number of suburban fire departments, law enforcement agencies, including the Highway Patrol, Oklahoma Highway Patrol. And we also do some industrial support as well through American Airlines Emergency Response Team here in Tulsa. And so I think the long and short of it is, if you like to help people, have I got a job for you? Although I'm currently occupying it, so it's hands off. It's not yours just yet. And you can also imagine when I go down to the embroidery shop for uniforms, they love me a lot because try to rep everybody's colors and make sure they know how proud I am to be associated with everybody that I get to support.
Yeah, it's always been my history that, you know, anytime that you find a medical director for any organization, they have like 27 different hats that they wear, and they're always pulled pillar to post, you know, just trying to help everybody out to make sure that, you know, their services are quality done. So we really appreciate, you know, the time that you're spending with us, and of course, you know, your service to your community. With your varied history and long history, getting on the topic of EMS Week, what have you kind of seen over the maturing of EMS Week and what it's become?
Well, yeah, and so this is a particularly meaningful EMS week, the 50th anniversary. And, you know, one of the things that I really have been so encouraged to see is the great support from the American College of Emergency Physicians. Now, you know, you might think I'm a little biased because I've also had some wonderful leadership opportunities within the American College of Emergency Physicians, ACEP or ACEP for short. including currently being the National Board of Directors chair. And it really is through this work that I best became aware of EMS Week. It really was something that it sort of came around. Maybe the hospitals did a little something back in the day when I was out in the field as an EMT and a paramedic, but sort of seeing the backside of it, if you will, the support of that through ACEP, partner organizations such as the American College of Surgeons Committee on Trauma, the National Association of EMTs, of course, industry partners. It's really been interesting to watch how EMS Week has grown. And I think because of that, not only do we still see, obviously, that local level of recognition, appreciation, support for EMS systems, but to also see some of the more marquee national events taking place. I know George Solomon, who was just visiting with us a little bit before we're doing this podcast today. George has been an incredible asset that we've picked up at ACEP, and he's been working with some of our DC-based team as well. Some exciting things going to happen on the National Mall here in just a few days, recognizing part of the vibrant history of modern EMS, some ambulance displays, some wonderful keynote speakers up there. Obviously reaching out, helping people doing some stop the bleed, hands-only CPR, recognizing the importance of EMS for children, all these things that we do throughout EMS Week, but trying to put an increasing spotlight on the importance of all of it, just knowing how important that it really is to the health and well-being of communities all around this country.
Yeah. Well, I think, in my experience, and I'd like you to chime in with yours too, that, especially post-COVID, it seems like there's been more of a focus on EMS and what EMS can do for their local communities and kind of the expansion of scope and practice with that. And, we've had, like you said, it's the 50th anniversary. We've had 50 years of EMS Week, and really early on for my career too. And I've been a paramedic since '97. You really didn't notice much. They set the week. Like you mentioned, the hospital might do something for you, or your agency might be doing a lunch or something for you, but there wasn't much talk about it out in the community. And I think that it's nice to see that we are, striving for a more, community awareness and input.
Yeah, and I think it's interesting. Obviously we know how to spell EMS. But in a lot of ways, I think we increasingly spell EMS YES, meaning when communities have problems, they increasingly turn to EMS for the yes, we'll find a way to help with that. Yes, we're not doing that now, and we'll find a way to add that to our mission in serving the community. And so, I think of some of the really great and exciting work that we are doing in Oklahoma City and Tulsa. Both the fire departments in particular, really invigorating mobile integrated health programs, not just to help those that, are high frequency utilizers because of some challenging social determinant of health situations. But reaching out, we know that opioid use disorder, it's a real illness, and it affects so many people. In fact, it's rare to find someone that doesn't have someone in their family, someone in their workplace, someone in their social circle, at least someone that finds themselves struggling with that. And so, particularly in the last couple of years, part of the work we do with medical oversight and support in our EMS system, we do 24/7, online medical consults, and the number of calls that I've taken, patients that are tragically in cardiac arrest in their 20s, 30s, 40s, not from early coronary disease, but from opioid toxidromes, particularly fentanyl overdoses, more recently. It's just so saddening when you think not only of the life lost there, but then obviously kids that are left behind, other family members, friends left behind. It's just so many years of life lost. And so I think there are, in Oklahoma City and Tulsa, like other cities around the country, there certainly are some wonderful community partners that we have that, are very oriented to helping folks with substance use disorder. But like so many other parts of healthcare, folks have to go to them. And, part of the unique thing that's always excited me about EMS, basically doesn't matter where you're at. You're having a crisis, we'll come to you, we'll find you. And we'll do everything we possibly can to make the difference that's needed. And so, we're rolling out opioid response teams, really trying to take advantage of the unfortunate but teachable moment when someone is fortunately able to be resuscitated with naloxone, some assisted ventilations, whatever part of the resuscitative bundle of care might be involved here. And those folks wake up and in a lot of cases, they didn't anticipate ever having that kind of reaction to whatever substance they were using or they thought they were using. And then really trying to find ways, maybe through buprenorphine, a bridge program to get them into one of these community partner programs. But I think it's exactly like you were saying, Ted. It's an exciting time to be in EMS. We have to always be careful that we keep our eyes on the primary mission of EMS. That is, the day-to-day 911. I think I'm having a heart attack. I think I'm having a stroke. I was just involved in a significant, vehicle collision. But the reality is, we have such dedicated, well-trained professionals in EMS that with some careful foresight and ongoing support, we can take these other missions to heart. And so I'm excited about that and what that really means when we think about celebrating EMS week as a country as a whole, but then the other 51 weeks of the year, what we're literally doing to change the day, so to speak, in the communities we're privileged to serve.
Yeah. And, to your point, our primary mission, of course, is emergency medicine. And, the heart attacks and the strokes will continue to happen. And, I fell out of a tree and broke my leg or, I wrecked my car. But there are so many other things. And we are showing, pretty significant impacts in overall healthcare and changing kind of the healthcare model for the United States with community health, mobile integrated health, community paramedic, whatever, the agency or the jurisdiction is calling it at the time, because I remember in the late 90s, early 2000s, it was community paramedic. And, reaching out to not just the repeat customers or the customers that are using 911 to get into the system. It's the use of the system to help people who've never been in the system before or have come out of the healthcare system and are at home. Keeping them home safely with medication mitigation, trip hazard, fall hazards, things like that. We watched the fire service do an amazing job with prevention, detection and prevention, of fires and reducing their fire calls. One would think that we could do something similar, taking a more proactive approach to healthcare out in the field, with something like mobile integrated health.
Yeah, absolutely agree. And I think that's, it really gets at the heart of Recognition Day on EMS week. Because I can't help but think we're here in May, not that many days from now we're going to be celebrating Memorial Day weekend. I really am a patriot at heart. I feel so incredibly blessed and lucky to have been born in the United States. What we sometimes take for granted, what I think people in society in general take for granted. Again, doesn't matter where you're at, what kind of crisis you may be having, you call 911. It's not just that somebody is coming, somebody that is specifically trained and has a truly dedicated public safety, public health servant's heart is going to try to do everything humanly possible to make that situation better for that person. It doesn't matter who they are. It doesn't matter, any kind of demographics. It doesn't matter if they have $1 million in their pocket or nothing in their pocket. we're going to come and we're going to try to make a real positive difference. And I think it's increasingly important that we recognize that. And I also think for those that are in EMS, it's tiring work. Your easiest day in EMS is still challenging by almost anyone else's standards. And so I think sometimes we just sort of come to accept, well, this is just how it is. I want to be careful we don't pat ourselves on the back so much that we're in need of a, shoulder dislocation reduction or something in our local emergency department. But the reality is, I really do want to share, a message of appreciation for, everyone in EMS for what they do. You don't just find this everywhere on planet Earth. And so, it's important that we really promote how important it is that we recognize EMS, what it stands for, the missions that it increasingly accepts to make a difference in the community. And I think, again, for those that, are in uniform and working in EMS, it can be exhausting. It often goes without a lot of verbally said thank yous and appreciations. But one of the things I try to always think about, is that even in a society that is increasingly distracted, if you're this far into the podcast, good on you, because, most of life now is, 140 characters or less on some social media post, or you can't even watch TV without, 2 or 3 scroll bars moving in opposite directions. It's just, we have, overload of the brain. And yet, for all of the activity, for all of the hurriedness of society, even for some of the cynicism of society, if you will, there's something magical that happens when somebody calls 911 or someone on their behalf calls 911. How many times, and again, I'm talking to folks in the profession here, how many times you get out of an ambulance, you get out of a fire apparatus, you get out of a SUV, squad car, whatever emergency vehicle you're in, right? You get out of there and you walk up to the patient, and far more often than not, there is immediate trust. And honestly, how cool is that? And, when that happens to me, I still love going out and making calls with EMTs and medics in the jurisdictions that I serve and support. They're not looking at me because of necessarily the name on the name bar on the uniform, but they're looking at me because of the uniform, who I represent, what I represent, not me as an individual per se. The fact that there is immediate trust, whether it's for themselves, their spouse of 50 years, their newborn child, whomever it's for, just the fact that even in this day and age, we still have that kind of trust immediately bestowed to us. It's really just an awesome thing. And I try to think of that often, because for me, that not only it invigorates my spirit, but it also replaces all those times that I think, well, a lot of things went on. We really did make a positive difference. Nobody really said thank you. It's just part of, things moving so quickly and so fast. I know that thank you comes in spirit later. It's just not able to necessarily be verbally shared at that point, because now we're far on to another call and they're not even sure who we were. In some ways, to me, that's always been part of the allure of EMS, because, if it was just for the money or the fame or, whatever, well, there'd be a lot of people willing to do it. And so for those that really stick it out for years and years, hats off to you. And you know what I'm talking about.
Yeah. Yeah, really, you do see that quite a bit. And, people don't get into the profession for the fame or the great working conditions or hours, being on a truck or in a response vehicle. But it is about, service and the, untangible thank you that you get, knowing that, you did a good job, that you were able to help somebody. And, going to somebody at their worst possible time, and to your point, having them trust you with this person is here to help me. That's a huge responsibility, for us every day, that somebody is out in the field, caring for somebody's grandmother or child, grandfather, or, everybody's got parents or siblings. And just to experience that kind of situation with somebody, to be there, and even if it is something as simple as holding their hand or comforting them to make sure that they know that it is going to be okay, that you are doing everything that you can for them, that type of personal interaction is quite immense.
Yeah, absolutely. And I think one of the other thoughts I have, and certainly my colleagues here in Oklahoma City, Tulsa, they've heard this more than once, but it's meaningful to me, and so I like to share it liberally. Is that the most powerful medication that we carry on any EMS apparatus, air, ground, watercraft, EMS hot air balloon, I mean, anything and everything is not spelled EPI or abbreviated with some chemical symbol. It's spelled HOPE, hope. And that is such a big part of what we bring to almost any situation when somebody has called 911 or however they reach us. That is a powerful thing. We see so many folks in such difficult places in their life. I think we sometimes, well, why do these people have these substance use issues? And don't they know this is bad for their health? And how could somebody live this way? The reality is things get really tough and people are just looking to escape for a little while. And sometimes that escape can be truly life-threatening. And so I always try to remember that myself, whether I'm seeing somebody on the street or in the hospital in the emergency department. The most important medication I could ever give somebody is hope. And I think that also is part of the importance of recognizing EMS, whether it's the 50th, anniversary of EMS week or any of the other 51 weeks of the year or into the 51st anniversary next year that we'll get to celebrate. But, whenever it is, just recognizing sometimes it's not the chemistry that we think about that really makes a huge difference in somebody's life. Sometimes it's some respect and kindness and hope. And I hope that people can appreciate that part of what we do in EMS. Usually most people think of EMS about the time that they're calling 911 or waiting for us to respond once they've called 911 or getting pre-arrival instructions and those kind of things. They just typically don't think about us a whole lot until they need us. It's okay. It's part of the equation. But I hope that there is, an increasing way that we can help people recognize what it is EMS does in their community every single hour of every single day. What an incredible part of a community. And honestly, just what an incredible journey it's been for me. As much as I've enjoyed the last 36, can't wait to see what the next however many brings.
Well, that's great. What a wonderful message. And thank you for spending time with us today. And, the topic of EMS recognition for EMS week. And, it isn't just 1 week a year. It's an everyday, 24 hours a day, 7 days a week thing. But it is nice that we take some time to self-reflect a little bit and make sure that we reach out to our colleagues and make sure that they feel, the renewed and the passion for what we're doing today and what we're going to do in the future.
That's great. Well, hey, listen, thanks for having me on, Ted. I've been a long time fan of JEMS and have been on the editorial board for a number of years now. Always enjoy writing some content for JEMS when the opportunity presents itself. And so I just want to thank you for everything you're doing and your team there. It really takes all of us to keep pushing the mission of EMS and the work that JEMS does in sharing the good news, sharing the challenging news, and always kind of helping us think about, okay, what's next? What's next on the radar, and how do we do it the appropriate way? Also just, hats off to everything you guys are doing at JEMS.
Well, thank you very much. And I hope to, I've been here for a little over a year and a half, and I hope to continue the tradition of JEMS. Like I said, I've been a paramedic since 1997. I remember, my early years of picking up a JEMS magazine and reading, what the experts were saying we should be doing out in the field. And I hope that we're continuing to herald that message and mission of bringing good quality information out to the providers.
Yeah, absolutely fantastic. So, well, again, thanks for the time today, and happy 50th EMS week with great appreciation to everyone in the EMS world, including my dear friends and colleagues at the American College of Emergency Physicians for really taking the baton on this and always championing and supporting this all of its 50 years. And again, great partnership with American College of Surgeons Committee on Trauma, National Association of EMTs, National Association of EMS Physicians, so many folks involved in this. Just what a wonderful occasion. Can't wait to be celebrating with everybody next week.
Yes, it's going to be great, and we couldn't do it alone. So thank you very much.